Welcome to Brava Academy, a webinar series where experts share their insights about the Brava Plus system. My name is Dr. Mira Shin, and I'm your host this evening for tonight's Brava Academy webinar. I am the clinical advisor for BRIAS, and I'm a board-certified orthodontist currently practicing in Dallas, Texas. I would love to introduce to everyone our wonderful speaker for tonight, Dr. Wu, who is a longtime Brava provider and a clinical faculty member who I had the immense pleasure of working with during my residency at Roseman University. He holds a wealth of knowledge and expertise, which I'm confident all of you will find very valuable in your own clinical practice. If you have any questions that you would like to ask Dr. Wu, please save them for the end of the session. You can place any questions that you may have in the Q&A tab for the Zoom presentation, and we'll go over all of the questions together after the presentation has concluded. So without further ado, I'm going to hand it over to Dr. Wu.
Thank you so much, Dr. Shen. Always a pleasure, and welcome everyone, no matter where in the world you're logging in from. I really appreciate you logging in and spending the time with me today. It's going to be a pretty short and efficient presentation. Hopefully, you all will each be able to take something away from today's presentation, which is titled Hyper Efficient Combo Treatment Using Brava Plus and Clear Liners. So let's get started. A little bit about my background here. I did my dental education from the University of Pennsylvania, followed by a orthodontic residency at University of Pittsburgh, with a little advanced education general dentistry residency at University of California, Los Angeles. And some of my areas of focus and areas of passion are in digital workflow, specific to in-house 3D printing of clear liners. I am one of the original founders of ULab Systems and ULab Clear Liners. And recently, these days, quite passionate about AI and implementing AI into the modern orthodontic office workflow. I am a full-time practicing orthodontist. I practice 4 days a week out of multiple office locations in and around the Bay Area, including in Redwood City, Palo Alto, and more recently, Watsonville, and the coastal community town of Monterey, California. So I'm always either on the road or in the clinic seeing patients Monday through Thursday. However, I wouldn't be able to enjoy speaking and presenting if it weren't for my superstar team. This is my office team in the Palo Alto office, and they're superstars, they're rock stars. Wanted to give a specific shout out to my business partner, Dr. AJ Brungo. He's the second individual in the back row from the left there. He's been awesome. Working with him has been a tremendous and rewarding experience, and just couldn't do all the things I do without his help and the team support. And then, of course, on Fridays, when I'm not in the clinic, I do enjoy teaching. Teaching is a passion of mine, been doing it for many, many years. And as Dr. Shin mentioned, I teach at Roseman University, which is in Henderson, Nevada, a suburb of Las Vegas. So I, along with a bunch of other faculty members, we fly down and cover the clinic. And it's just a wonderful, wonderful program. We teach them everything that we do here in our private practice, including Brava, as well as in-house clear liners, combination treatment, the whole 9 yards. And of course, my kids, Misa and PJ, who are now 14 and 12, they love to travel whenever their school schedule allows. So on the left there was a recent trip to Colorado Springs. And on the right there was a recent trip to the islands, the big island of Hawaii. So they love traveling along with dad whenever they can. Okay, so one of the most important tenets of today's presentation is really about the treatment efficiency as far as treatment time when it comes to Brava, independent tooth movement. And unlike some of our more traditional modalities of treatment, it really excels at moving teeth in all planes of space right from the get-go. So in traditional modalities, we kind of have to level a line, then we've got to close spaces, and then we detail and just, each sequence of treatment has to occur before the subsequent sequence can occur. And so it tends to drag on a little bit longer, whereas with independent tooth movement, we can kind of focus on multiple movements in all planes of space all at once. And so I think that's where the power of the efficiency of the Brava appliance comes in when it's compared with some of our more traditional fixed or clear aligner modalities. If you think about the design of Brava biomechanically, it kind of makes sense why it's so efficient. So, in our more traditional mechanics of either straight wire appliances or clear liners, we can see that biomechanically, your lever arm can be significantly larger, especially when it comes to the application of force in the curvature of the arch when applied to that terminal molar tooth. Whereas with Brava, the application of the independent control arm is so much shorter, about 6 millimeters measured from the tooth to the anchorage bar. And so, because of that shorter application of distance, we're enjoying a much more efficient and effective mode of orthodontic tooth movement. And it excels in certain movements, such as the intrusion of lower incisors for an adult deep bite. So, this is one of the things that I love about Brava independent tooth movement as compared with our traditional orthodontic modalities. But moreover, when each tooth is controlled independently on its own, and we do have the propensity and the wherewithal to customize our force application to each individual tooth, meaning that we don't have to have the same force along all of the teeth. We can actually individually customize and optimize the force level on each individual tooth. So, why is this relevant? Well, let's say you have an adult patient with a compromised incisor tooth periodontally, and you want to minimize the force applied to said tooth. Well, you can do that. You can apply that level of customization with Brava, and we never had that ability in traditional braces or even aligners per se. It was very hard to customize specific forces on a given specific tooth. So that's been a game changer in our practice. Now, the opposite can also be said for Brava, just like we can reduce the level of force on an individual tooth, you can also apply a higher force on an individual tooth when needed. So the introduction of these higher force arms will deliver 2 to 4 times the level of force as needed. And what determines the higher force application is really the inherent algorithms of the Brava software. It will automatically calculate which teeth require this higher force arms and will implement that into the design of the Brava Plus appliance. So where is this important? Where is this clinically relevant? It's almost like in the finishing stage of traditional brackets, just like we would finish in like a stiffer stainless steel wire, where maybe we want to really increase the level of force to kind of finish and get the teeth into the final positions. Well, this is sort of that same concept where they can apply a higher force arm to really ensure that we move that tooth into the final position. So that's been wonderful. So most of you on the call probably have some degree of experience with Brava Plus. For those of you that are just kind of starting out, um, case selection is important. You got to know how to walk before you run, right? So our level one cases are pretty self-explanatory. These are very manageable, minor cases, minor deep bite, mild to moderate crowding, maybe anterior single tooth or two tooth anterior cross bites, sagittal, minor sagittal correction, maybe some discrepancy in the transverse, just very straightforward cases to kind of get your feet wet. Your level two cases are going to take that a step further, maybe severe crowding, severe rotations. Now we're looking at moderate to severe bite corrections, possibly extraction cases, bicuspid extraction cases included. But these are definitely the more challenging cases. Maybe you've got a transposed tooth situation, like on that left side with the canine and the bicuspid. But these are definitely the more advanced or moderate level type Brava cases to attempt. And definitely, I would say, unless you've got quite a few level one cases under your belt, you probably want to get that experience before you try to tackle these level twos. And then come the advanced levels, the level three cases, right? These are difficult, complex cases. Maybe they're interdisciplinary, involving various specialties. Maybe it's a patient with mutilated dentition, mixed dentition, baby teeth, or a patient with small clinical crowns. We know that in order to bond the appliance on, we need a certain clinical crown height of at least 2.5 millimeters. And anything less than that can be quite challenging. Maybe some of the patient's anatomy, such as dental tori on the lower lingual arch, is interfering with the placement of the Brava appliance. So these are all considerations to take into account for these level three cases. Maybe it's an orthodontic surgery case. These are definitely the advanced level cases that require significant Brava experience. So one of the main tenets of my presentation today is kind of introducing this concept of combination treatment. And this is something that we've been doing in our practice for years and years and years. The concept started, of course, with labial brackets on the facial of the teeth for about anywhere between 6 to 9 months, and just really getting the difficult, more unpredictable movements completed before transitioning over to clear aligners. So this article that I authored in the 2022 June issue of Seminars in Orthodontics kind of details this process. But really, it's utilizing the best strengths of both worlds. We're utilizing the strengths and predictability of fixed appliances for a limited amount of time, movements that typically would be very difficult for like a clear liner, such as extrusion, significant severe rotations, and or the need for significant posterior expansion. So whenever I come across cases with these clinical needs and the patient comes in asking for clear liners, or usually it's Invisalign, the brand, I spend quite a bit of time educating them that, hey, you may not be an ideal clear liner candidate right off the bat, but you certainly could be a combination candidate where we can start with brackets in the beginning and then transition you to what we call finishing clear aligners. With that, clear liners, as we all know, is very popular these days all across the world, not just in the US. And I think where clear liners really excel is that it's very precise. It's easy to comply with. They're typically very good for detailing these smaller types of finishing movements. And so, again, just kind of honing down onto the detail of this, when I'm in my fixed appliance phase, these are my treatment goals, is I'm trying to resolve all of the problem issues in all of these dimensions, the transverse or vertical or AP or torque, severe rotations, and vertical incisor display or VID, and smile arc. And then in my clear liner phase, I'm really just about detail and minor finishing. The goal is not to have another 20 or 30 aligners on the tail end. Really, the fixed appliance phase is about minimizing the number of clear aligners on the tail end for the patient. So think more like 5 to 10. That's the sweet spot as far as number of finishing clear aligners as our goal. So I love this little infographic analogy with our Brava appliance as our first appliance of choice. It's kind of like taking a rocket ship from Earth to the moon. So it gets us all the way over to the surface of the moon. It traverses that big distance. And so it's really kind of helping us bridge that gap between where we start and sort of our final finish line. And then when we transition over to our clear liners, it's akin to our lunar landing craft. So it's allowing us to go from the moon's orbit to landing on an exact spot on the surface of the moon to reach our goal, to reach our destination, right? And so that's typically the analogy that I like to think about for this concept of combination treatment. So here is a patient, Matthew. This is actually one of our very first Brava cases that we treated. If you pay attention to the date, this patient we started at the end of 2021. Now, this patient works in tech, a very busy guy, always speaking in front of clients and people. Of course, he was concerned with the crowding on his lower arch. He didn't like the lower incisor there. And for this patient, it was important to have something aesthetic. And so initially, we talked about labial appliances. That was obviously not an option with him. We talked about aligners, but with aligners, I was thinking that it would probably be at least a year to a year and a half long process, and that's assuming that he would comply and wear all the aligners. And it was right around this time that we started looking into Brava as a treatment modality. But more importantly, if you all remember, at the end of 21, that was right around the time that the Omicron variant of the COVID virus hit. And so, unfortunately, it was a very challenging time for us and as well as for the patients. This is just kind of reviewing his imaging on the panel. You can appreciate how crowded and super erupted his lower incisor was. And there is his Ceph. He's definitely a deep bite adult middle-aged male. A bit of a challenging case for traditional appliances. So what happened was we had bonded Matthew at the end of 21, November, and then Omicron, COVID hit, and Matthew no longer felt safe coming into the office. And so he disappears. He disappears for about 4 months. Finally, in the spring of 22, he reappears and comes in, and this is how he looked like. Now, remember, I had done nothing except for bond his appliances. Up until this point, like we hadn't started any class two rubber bands, we hadn't prescribed or we hadn't performed any IPR. This was purely the Brava appliances doing their thing during COVID. And this is really the case that opened my eyes to lingual because before this, I was very anti-lingual. In fact, funny story. But when you compare his Brava plan with what actually expressed clinically, it was very, very close. Again, because he didn't show up to the office during COVID, I didn't have a chance to perform that lower incisor IPR. So you can see the lowers are still a little off, and his bite was still a bit open. So at that point, at the 4 month mark, he was ready to get him off. And I said, fine, we'll transition you over to aligners and we will finish the alignment. So here is his setup that I can show you. This is an earlier version of ULab, but you guys will probably get the idea here is that it's a very limited aligner set, only 2 trays on the top to resolve some torque issues. Lower IPR was performed, and we're continuing to retract his lower anteriors for the interference in his bite. So in total, his treatment with Brava, along with clear aligners, took only 6 months. And certainly, I think this is argument can be made that, combination treatment can be extremely profitable. This is just a nominal example of traditional orthodontic modalities by themselves versus what is possible with combination treatment. So on the left column is our treatment fee. Then we have our expense column. So we have our Brava lab fee combined with the 7 aligners that I made with ULab at $20 an aligner. So all in, my lab expenses on this case was $1,440. That's US dollars. And you can see the number of visits were very minimal at 5 visits. So our net fee generated per visit was $1,112. So very, very efficient and profitable treatment. This young man actually is a Stanford student, and he came to us because he wasn't happy with his bite on that left side. We talked to him about some options, labial brackets, aligners alone. But at the end of the day, he was really interested in something not visible on the front of his teeth, which is why we went with Brava. And you can see here he's got a class 2 occlusion on that left-hand side. But more importantly, we talked to him about his tooth size discrepancy, his small upper laterals, and the importance of working with our local dental professional with adding cosmetic bonding at the conclusion of his treatment. So that was the plan. We have his imaging here. You can appreciate how open his bite is on that left-hand side there and how deep. But these are certainly one of the most challenging cases that all of us treat in our offices, right? These brachycephalic, short lower face height individuals with a malocclusion on one side. These are not easy cases. And so, always a challenge. So we had this young man in Brava appliances for about 11 months. And of course, you can see we opened up spaces on either side of his laterals for the cosmetic bonding. But look at how dialed in his canine occlusion was on the left side. Probably could have seated the molar a little bit better on that left side. But nevertheless, he was ready to transition to clear aligners. I'm sorry, I didn't have a chance to upload his aligner plan, but essentially we consolidated his spacing between the upper ones, and then he went and got the small laterals restored. So this is his final at 16 months with the space closed between the upper ones, and his cosmetic bonding is done. And to retain, we have him wearing clear retainers, top and bottom, at nights only. This is a Roseman case. This is one of my Roseman doctors, Dr. Basra. And this young lady, interestingly enough, she drives from Salt Lake City, Utah, down to Las Vegas, Nevada. That's about a 4.5 to 5 hour drive, everyone, one way. So this young lady sought out Roseman because explicitly she knew that the clinicians there offered Brava as a treatment modality. One of the biggest challenges with this case is root angulation or root tip. You can see her lower incisors have some significant root tip on it, as well as some significant rotations. These are some of the hardest and most challenging movements to do in clear aligners, as I'm sure all of you know. And so Dr. Bosra and I talked, and we felt that by treating her in combination with Brava first and then transitioning over to clear aligners would give her the best results. So that's what we did. And so here she is actually at D-bond of the Brava appliances, 11 months. But look at how excellent Dr. Basra treated this patient. And I just want to give him a shout out because he did this with zero clinical training. He simply went online, utilized the online resources, and learned on his own. And he was able to do this complete case all by himself. So kudos to you, Dr. Basra. Okay, and so sort of my last case here. I know we're kind of coming to an end with our time. This is Roger, and Roger is a professor at one of the local universities here. And Roger was interested in preparing his teeth, preparing the sites of the missing teeth for implants. So you can see he's gone through treatment before as a child, but unfortunately, it looks like he lost or broke the upper right six there, as well as the lower right cuspid, kind of an unusual missing tooth pattern. But anyways, Roger, of course, lectures quite a bit for his profession and didn't want anything visible on his teeth. But more importantly, he wanted fast. He wanted fast and efficient treatment to go smoothly. He didn't want to be in treatment for an extended amount of time. So we had Roger extract the remaining root tips. We got his Brava Plus appliances on. Now, as you can see, we didn't extend the upper Brava appliance all the way back to the molars on the upper right. And I felt that that would probably increase his level of comfort. I didn't feel like those molars on the upper right needed a whole lot of uprighting or discalization, so we just kind of left them be. We did have to put some bite pillows on the occlusal of his upper premolars to disocclude him and prevent the patient from biting into his upper Brava appliances. But this is at the first month post bonding, not much going on there. But you can see by month 2, we're starting to see some pretty significant correction in both tip, torque, and rotations. We're starting to really develop the space. And then at 2.5 months, he's essentially almost done. Now, how the heck did this happen? Well, what I didn't share with you all yet is we utilized yet another piece of technology in this case, called OrthoPulse. And OrthoPulse is based on near infrared light therapy, and it helps to not only accelerate tooth movement, but it also eliminates orthodontic tooth movement pain. So, this is at 3.5 months when we took off Roger's Brava appliances. And now we moved him into aligners. You can see he's still got some torque discrepancy with the upper and lower anterior teeth. And then I believe we're also distalizing a bit more for the implant spaces. So let's take a look at his setup. So this is our most current version of ULab. Hopefully this plays. Yes. Okay. So he's got about 10 sets of trays, 10 for the top, 10 for the bottom, just touching up the space for the upper right, resolving some torque issues, upper and lower, a little bit of IPR for his soft tissue triangle between the upper ones, and a bit of class 2 elastics on that right-hand side to support the distalization there. So not super complicated. Again, we're really trying to minimize the number of clear aligners on the tail end. We don't want the patients to be in this long drawn out aligner treatment phase. And for those of you that are not familiar with OrthoPulse, I'll just go over this really quickly. This is what it is. It's a wireless device, medical device. It utilizes a wavelength of light of 850 nanometers, so that's near infrared. And that wavelength of light does several things. It stimulates several different pathways, including the cytochrome C oxidase pathway for all of you biochemists out there, which upregulates ATP, mitochondria. It also stimulates the reactive oxygen pathway and the nitric oxide pathway. All three pathways are synergistic and accelerates bone remodeling and tooth movement. And so this is great. We use this technology on all of our patients, not just on our lingual appliance patients, on our labial bracket patients, as well as our aligner patients. One of the great things about it is that it will also eliminate 75% of the pain associated with it. So if you're interested, there's a bunch of clinical studies that back up the science behind this. Go to orthopulse.com and you can read up on the clinical studies with this, but it's been definitely a game changer for us. So in summary, guys, just want to say the future of our profession of orthodontics is not having to choose between a single treatment modality of either braces or aligners. But I think it's really key about strategically integrating multiple treatment modalities such as Brava Plus and clear aligners and or OrthoPulse. And so I hope I've kind of brought in some horizons here that this integration of combination therapy and workflow can really maximize treatment efficiency, predictability, and patient satisfaction. It has in our practice and hope it can with yours. And with that, I want to say a big thank you to you all for logging in and spending the time with me today. That is my email address. Feel free to reach out with any questions, comments, feedback, and thank you.